All right, good evening, everybody. Good evening to all those watching on the webcast. This is the People's Scrutiny Committee on the 15th of April 2026. I'm Councillor Jane Burton, I'm chair of this committee. We're just going to go through some housekeeping. First of all, apologies for absence, and apologies have been received from councillors Mason, Nelson and Nichols, who were substituted by Councillor Vassey, Councillor Wells and Councillor Stewart respectively. I don't think Councillor Vassey's quite here yet, but I'm sure he'll be here sometime soon. Could I ask, does anybody have any declarations of interest to declare? Any members? No. Okay, fine. Yes, Councillor Cuthbertson.
It's not really an interest, but I should make members aware that I'm an appointed governor of Leeds York Partnership Foundation Trust.
You're sorry, I didn't.
Leeds York Partnership Foundation.
Okay.
LYPFT, which
yes,
is in
yes,
Scotland.
yes, yeah.
And I have no hand in putting together the information.
You didn't?
I didn't.
No.
I had no hand in it whatsoever.
Okay, but you are a member of that trust. Okay, thank you very much, Councillor Cuthbertson. There we are, very good. So tonight, the main and only item on this part of the agenda is City of York Safeguarding Adults. Safeguarding Board Annual Report 2024 to 2025. Oh, excuse me. There's been no registration for members of the public to speak tonight, so there's no public participation. So that's my fault. I'm getting a bit ahead of myself tonight. It's the excitement of being back. So City of York Safeguarding Adults Safeguarding Board Annual Report 2024-2025. And I have tonight Jane Timpson, who's Independent Chair of City of York Safeguarding Adults Board. Michael Melvin, Director of Adults Safeguarding. Sarah Story, Corporate Director of Adult Social Care. And Councillor Steels Walshaw, who's Executive Member for Health, Wellbeing and Adult Social Care. And what we're being asked to do is note the contents of the annual report and consider how we can contribute to the joint work of the board and note strategic plans for 2025 onwards and how they can be supported. I'm not going to go into all the things on the agenda because I think, hello, Councillor Vassey. I think Jane and Michael are going to cover that in the presentation that they're about to give. So going to give a presentation about the report and we shall be ready to give our and ask questions at the end. Thank you very much. Please take your time as well.
Thank you, Chair. I'd just like to, before we hand over to Jane and Michael to present, I'd just like to thank Jane, our Independent Chair, for all of her work in terms of the leadership that she's demonstrated in chairing the board and the partnership in York over the last year and a half.
Less.
A bit less than that. And in particular, the significant progress that the partnership has made under Jane's leadership in terms of the improvements, the level of engagement that we've seen from not just the 3 statutory partners to the board, but a significant range of partners from across various York organisations, and then the progress that, you know, as that engaged partnership has worked together, the progress that has been made to put in place process systems and support to adults in the City of York. The second thing I'd like to say is that I am here, obviously, as the Director of Adult Social Services in my statutory role. I do represent City of York Council, but I'm also representing the 3 statutory partners to the board. The police and ICB weren't able to join us tonight, so we did agree that I would be the one that was here today. So thank you, Jane. Really appreciate the work. So I'll hand over to you to present the paper, if that's okay. Thank you.
Thank you very much. Sorry, we're going to actually put the slides on the webcast. So there'll be a slight delay for those watching from home or watching later on the, it's not gone wrong. Sorry, Councillor Waller.
Will the slides be circulated after the meeting?
They are in the packet.
They are in.
Actually.
That's fine. Just wanted to
Yeah.
check that what
Yeah.
you said.
Chair, they're not totally in the pack. They're about 80% in the pack.
Okay.
Because the words slide off the end. Yeah, well, I know that they're there, but I can't read them all because it's chopped off.
My pack was okay. Okay, thank you for that. Well,
So they do
we'll
need
ensure that
circulating,
there's
yeah.
a set sent.
I mean, I can guess what they say, but I'd rather
Yes.
know.
No, it's best to know.
Thank you.
Thank you very much for that. So we can make sure that they're sent round, okay?
I'll resend them round to everyone.
Okay, thank you very much. Sorry about the delay.
No problem. So thank you for allowing me to come this evening to present the City of York Safeguarding Adult Board annual report. It is a retrospective report because it does talk about the work that we did in the financial year 24 to 25. And of course, we're now at the start of 26-27, and it is just to do with the governance timescale. So I apologise for the delay, but it is just the way it works. Just to answer the councillor's question before I start, the annual report is available online on the board website, and I will be giving you those addresses at the end of this presentation. But I think Reese has kindly offered to just resend it out as a report in its own right. So you should get it in its entirety that way. So apologies if you haven't got a terribly good version to read. Michael, I think you already know. And as Sarah said, I have actually been in post as independent chair for 18 months. It feels less, but it was 18 months at the end of March because I started on the 1st of September 24. So first year in York. And there was a pivotal change to the safeguarding board in 24-25 because not only did the chair change, I took over from a chair who I think had been in post 6 years before me, but it was the first year that the safeguarding board actually had appointed a board manager to support the work of the safeguarding board. And I think it's that post that has made a huge difference to the amount of work that the board has been able to produce, because you've got a manager who can actually help produce the working parties and organise the stuff in the background to make sure that there is progress in the work of safeguarding. So I think that was a real pivotal moment for the safeguarding board locally. So, my role tonight is just to provide a summary of the safeguarding report, but with a focus on the strategy that we developed as a board for 25-28. But on the slide behind me are the items I will cover as part of that summary. I will answer questions at the end, and I would suggest if you do have individual cases you want to talk about, I would suggest this isn't the arena for that, but we're more than welcome for those to be given to us after the meeting, either individually or we can redirect, or you can contact me and I will signpost you. But I think discussing individuals here in what is effectively a public arena is probably not the right thing to do. So thank you for that. So, just before I go through the report, I think it might be useful just to put the safeguarding board into context for you. The Care Act 2014 was the first time that a safeguarding board was put on a statutory footing. Local authorities had safeguarding arrangements, but the Care Act, which is now 10 years old, was when the safeguarding board became a statutory duty to have in place by every local authority. Within the Care Act, there are three main statutory roles for the boards to do. The first is to publish a strategic plan for each financial year, outlining how the board will meet objectives and what each board partner will do to meet those objectives. publish an annual report detailing the board activities and performance. So that's what was in your packs. And also arrange a safeguarding adult review for cases where an adult with care and support needs has died or experienced serious neglect and abuse. And there is concern about how agencies work together to safeguard that individual. The board doesn't do that in isolation, but does it with the help of our partners within York, and that includes the Safer York Partnership, also the Children's Safeguarding Partnership and the Domestic Abuse Partnership. So there can be an overlap between some of our strategic priorities, but with a different lens. As you know, local authorities have the duty to safeguard adults with care and support needs if they're experiencing abuse and neglect and are not in a position to protect themselves because of their care and support needs. And the director, Sarah, and the lead member, Lucy, are the key points for professional and political accountability. But all agencies and providers and actually elected members do have responsibilities to safeguard adults, and as well as promoting wellbeing and providing advice in relation to safeguarding. Certainly in relation for the council's viewpoint, in relation to the safeguarding duty, it's everybody's business to raise a concern, and then the local authority can make a decision about whether the statutory duty to actually intervene is met. Okay, so within the Care Act, it does list 4 key objectives and functions for any safeguarding board. There's a focus on prevention to help develop strategies to prevent abuse and neglect. There's a role of accountability to ensure that agencies and partners, and while the 3 statutory partners are the local authority, the NHS and the police, we invite other partners to be part of that safeguarding board that we think can support the role of safeguarding locally. And we want to make sure that they all have robust, effective safeguarding arrangements locally. There is a responsibility, a statutory duty to work in partnership to help coordinate and ensure multi-agency involvement with individuals, and also a role with reviewing safeguarding data to identify risks and improve practice. So who is City of York Safeguarding Adult Board? We've already mentioned the 3 statutory partners. In 24-25, we did strengthen the membership of the board to ensure that we had more of a view from services who were frontline and providing support to individuals with care and support needs, as well as trying to increase our ability to understand lived experience of individuals who are experiencing safeguarding. So without going through the circle behind me on the board, which I know you can't see because it's even tiny on the screen in front of me, but as well as the 3 statutory partners, we have York CVS, Health Watch, we've recently invited the Department of Work and Pensions, we have Probation, North Yorkshire Fire Rescue Service, Advocacy Hub, as well as the various health representatives from the hospitals who service York. Okay, as a board, we meet 4 times a year, and during the year 24-25, there were 4 subgroups. The executive group, which helps set the agenda for the safeguarding board, the wider safeguarding board, as well as coming up with a plan about what we need to do locally. We have a quality insurance subgroup, a review and learning subgroup, and in 24-25, we had a voice of the city subgroup as well. We changed that. That was part of the work we did in 24-25. And the arrangements we have now help better reflect the priorities that we are trying to achieve locally. So there's more emphasis on safeguarding adult reviews. So not just being able to identify when a case should be considered for a safeguarding adult review, but for making sure there is progress on that review and outcomes, and that we can demonstrate that review has made a difference, and that all agencies have embedded learning from that review to hopefully prevent similar situations happening. The quality insurance group have, I'm going to say strengthened, because of the other subgroups, has taken some of the burden off the quality insurance group, which is very ably chaired by Michael, but they were carrying the bulk of the work until we've made this new arrangement. And the learning and development subgroup, which has been set up, is pivotal to help us identify that learning and roll that out on a wider footprint. Within that, we also have 3 task and finish groups which focus on the actual strategic aims of the board. So there are a self-neglect group, a rough sleeping and homelessness, and an exploitation group, which I'll cover a little bit later. We are really keen to ensure that the work of the board is shaped by individuals' lived experience. And we've been working hard to ensure that we're not just looking at quantitative data, but that we are looking at qualitative data as well. Within the annual report that you've got in front of you, there is an anonymised case study detailing the importance of enabling individuals to express their views. So not just about what's happening to them, but what they would like as part of their care planning, and helping that person come up with a plan to address the risks that either they are posing to others or they are facing themselves. That's called making safeguarding personal. But the case example shows how effective that can be when that person's at the centre of the work to ensure those risks are being mitigated. Part of the my role as the safeguarding chair has been to ensure that we really understand why the board is meeting. So at every board meeting, we do have a standing agenda item now about what difference do we make? And that's an opportunity for all partners to bring case studies to the board. And they don't always have to be good news. You know, we need to also understand where, if there are sticky bits, we need to understand that to help us unpick. So it's really important that we get that feedback from individuals who are going through safeguarding. So in 24-25, I think it's fair to say it was a consolidation year for the board. So with the board manager, we were able to review the arrangements that we had locally. We had a big focus on governance, membership, as well as, like I say, the safeguarding adult review process, which I think I'm not saying we've maybe changed, but we've made more robust in the way that we're able to measure. I think it's unfair to say we've changed it because the process was there. It's just, it's got more emphasis. But within 24-25, as well as building the strategy for 25-28, the board did publish self-neglect practice guidance because we were aware at that point that that was an area that we needed to improve locally, and we've since had safeguarding adult reviews that has shown us that is an area that we need to improve locally. Safeguarding practice guidance is for all professionals working with people with care and support needs, as well as their carers. I think you all understand what self-neglect is. It's where there's an extreme lack of self-care. So people either ignoring their social or physical needs, or it can sometimes be associated with hoarding, or it may be a result of other issues such as drug or alcohol misuse. And what we know is engaging with the individual is crucial. And the earlier we can do that, the easier it is to try and help that person on their journey to recovery. There is a need to offer support without causing distress, but we also understand the limitations of interventions, and it's about encouraging the person to engage and not walking away when at the first refusal. It's about finding different ways, or a different person or a different organisation who can engage that individual. The other main document that, again, we have learned from safeguarding adult reviews was to help improve professional curiosity. So we have some guidance now for staff. It's not just this area, it's something that's coming out as safeguarding adult reviews across the country, the real need to understand those why questions, so that you're really understanding why the person's in the situation that they are and not accepting it at face value. So it's about drilling down. So the guidance is to help people from any organisation challenge what they're seeing, either challenge themselves or even challenge the person, just so they can understand why they're in the situation that they are. It is easy to use, and it is about helping to build up a relationship with the person. The other significant protocol that got produced in 24-25 is the escalation protocol. And that was about a framework to manage professional disagreements about safeguarding practice. So it's literally an escalation. So, you know, peer to peer, if that's not working, the process goes up to a team manager, to a head of service, director, ultimately to Richard, myself. But there's, you know, it doesn't matter what the issue is, but there's a stepped process to help find a resolution, rather than just accepting what an agency might be saying. So it's definitely been adopted. It's in use, and it just opens those conversations so people know that they are able to challenge if they're not sure what is happening or not happening is the correct path. Other areas which were part of the previous strategy are strengthening partnership working. You'll see when we go through the strategy for 24-25, that was a pivotal part of that. But we've also held successful safeguarding weeks in 24-25, as well as maintaining the public-facing website. And I've already mentioned about the governance. So you'll be pleased to hear, I'm not going to go by blow, line by line account of the data. It is in the pack. It does explain the data. But what the board is seeing is a continued annual increase of over 10% every year of the safeguarding concerns received. And actually, there's a 42% increase in safeguarding concerns within York since 21-22. That is a national picture that we are reflecting locally in York. In 24-25, just over 65% of those concerns were progressed to a safeguarding inquiry. Now, that is higher than the previous year, and it is actually higher than the national average. We aren't worried about that locally. We see it as a positive thing because it does mean that locally we are robust in establishing whether abuse or neglect has taken place and putting in measures to safeguard that. It's really hard because the data is so weird nationally. It varies from 3% in some places to 97% in other areas. So it's really hard to know whether our conversion rate is right. But like I say, we've looked at the data and we're comfortable with it. But some areas it's much lower, that conversion. There were, in relation to the number of individuals involved in safeguarding inquiries, that has remained stable. The slide behind me does talk about other inquiries. That is when someone may not have care and support needs. So they may have support needs, but don't actually need care. So it could be, for example, a carer who has needs support to manage their role as a carer, but doesn't need care in their own right. So they may well need safeguarding support. That would be considered an other, because it doesn't fit in with that criteria about having care and support needs. Is that, yeah? So those numbers have remained relatively stable locally. In relation to safeguarding adult reviews, within 24-25, there was one published, and one was near completion in 24-25. At the moment, there's currently a number in progress. There was a backlog of referrals that decisions hadn't been made on. So 25-26 has been quite a difficult year because the number of safeguarding adult reviews that we're currently completing. But that has been really helpful for us because it's given us a good picture of where we want to improve and has really helped shape our strategy going forward. So in 24-25, forgive me, I'm not sure how long this previous strategy process, the strategy was in place for, whether it was a 3-year programme or longer. I don't know if you know, Michael.
It was a 1-year. Yeah.
I should know that, and I apologise. So I inherited, or the board when I took over had this in place, and it was the six strategic priorities. We haven't, we worked on those during 24-25. They haven't gone away, but actually I would argue that those priorities are the backbone of what all boards should be doing. So we are still doing them, but now we've put the emphasis on particular pieces of work, which I'll go through shortly. I think the key takeaway from our board is it's a very proactive community, and they are working together. The partners do work together well, and there's a real keenness to work cross-border as well. So, you know, we have partners who have a wider footprint. That's really helpful for us because they're bringing information from other areas they work in. We also are stretching out and reaching out to North Yorkshire, for example, and doing work collaboratively with them as well. We're a small board. We can't do it all ourselves. So, you know, we're looking for partners to support and vice versa. So in relation to safeguarding adult reviews, in the report, you have the Julie SAR. Again, she did have complex needs, including anorexia, mental health issues, substance misuse, and self-neglect, living in private rented accommodation in York. But because of her issues, the accommodation didn't meet her needs towards the end of her life. But she was known to several agencies across the borough, as well as, because of her health needs, was in and out of hospital and rehabilitation as well due to her self-neglect. The learning from the Safeguarding Adult Review did make some strong recommendations for the board, and we have been seeking agency assurance and alignment of safeguarding priorities in relation to multi-agency communication. That's why you've got the escalation protocol now. It did talk about some strengthening of eating disorder team processes. So we've had the assurance about that. It also highlighted about patients not attending appointments, and so there was some work done about the do not attend policy locally and about how you need to follow that up, rather than to say that someone, if they don't turn up 3 times, they're back to the beginning. You need to understand why that person might not be turning up. So there's been some good work by hospitals on that. As well as helping us learn from the lived experience and the voice of the adult as well. And again, it's fed into our self-neglect work, which we'll be covering shortly. Within 24-25, the board also received 13 referrals from agencies for consideration of a safeguarding adult review. Of those 13, 6 were approved for a review, 5 of which were of a statutory nature and 1 was discretionary, which meant that while we may not have had concerns about the way agencies work together, we felt there was enough learning that could be extracted from doing a review that would be useful for all partners. So 6 safeguarding adult reviews were commissioned in 24-25. So within your packs, you do have the strategy for the board 25-28. That was developed by examining the evidence from the board's work over the last 2 years, including outcomes from a partner challenge event that we held in early 2025, as well as looking at trends and themes that emerged from the recommendations from the safeguarding adult reviews. So we also looked at trends and data, including the types of abuse, victims, locations, and source of referrals, and also continue to reflect on legislation, guidance, and best practice in adult safeguarding from regional and national networks as well. We also listen to partners who work alongside the public and professionals to understand their view about what our priorities should be. So it was a proper piece of collaboration to come up with the strategy, which for members of the public, we have published on I'd say plan on a page, but actually we did our best to get it on one. But it is quite helpful because it's a good summary of what we're trying to achieve as a safeguarding board. So prevention, awareness and engagement, that's continuing to collaborate with community groups to promote safeguarding awareness. So I'm going to just change the slide, I haven't kept up. And develop tailored approaches to prevention to increase safeguarding knowledge and awareness within targeted groups. We are wanting to develop and deliver public messages and promote safeguarding awareness campaigns aimed at the public by providing clear guidance and support for those who raise concerns. And we will maximise Safeguarding Week engagement, promoting it with multi-agency contributions to present a variety of online and face-to-face sessions to support that priority as well. The second priority is learning, reflection and practice improvement. I already mentioned about the work we did to strengthen the outcomes from safeguarding adult reviews. So that's what this one is. And the learning and development subgroup has been created to help ensure a learning and development training strategy to disseminate that learning and help develop confident practice for all those who have a safeguarding role. We also continue to find ways to capture lived experience of safeguarding and engaging with families and frontline staff so they can inform practice improvements. And then the third arm of this strategy is strengthening multi-agency safeguarding responses. And we've divided that into three parts. Adults at risk of exploitation. So we've created a task and finish group to hone in on that, to explore multi-agency responses to adults at risk of exploitation, including developing and implementing pathways, as well as providing guidance and protocols to support individuals who experience multiple disadvantage to help mitigate the risks faced by those individuals. We also want to embed the need to report concerns about any person in a position of trust and ensure that pathways to address concerns are embedded in practice. And we will be seeking assurance about the quality of services and the practice of those services by the development of a multi-agency dashboard to help identify themes and trends across the board. The second arm of that is adults at risk of self-neglect and hoarding. We know that is an area that we are really homing in on. I will be talking a couple of slides later about the self-neglect thematic review that we recently completed. So that's to ensure there's a clear, accessible pathway to identify concerns and to assess and respond, and making sure that we have an agency that is taking lead responsibility and that all partners are supporting. Is what we know from self-neglect is no one agency has the answer. It has to be done collaboratively to help make a difference to that individual. One of the things we've introduced under that and is actually coming to the board next week is a multi-agency risk management protocol. So that's about agencies coming together to address individual risk for a person so that we have a multifaceted risk management plan for an individual instead of it being done by individual agencies. And then the third arm is about adults at risk of rough sleeping and homelessness. Again, a task and finish group. We've been engaging with the specialists to explore what good looks like, to develop and implement pathways and more guidance and protocols, and working very closely with the council who are leading on a homelessness strategy, and we're making sure that those with care and support needs are being considered as part of that wider picture. Forgive me, I've stuck on one slide and I haven't shared these. So I'll just pause slowly, but that's more or less what I've just been saying. Okay. So to be aware of the future, you'll be aware of the national care reforms led by Baroness Casey, and she made an announcement earlier this month, I think it was, making it clear that there need to be a much stronger government focus on adult safeguarding, and made a recommendation for the immediate formation of a national safeguarding board. That's been agreed, and that will actually reinforce the role of safeguarding adult boards to ensure they remain effective, well-governed and sufficiently empowered to respond to high-risk scenarios with consistency. For the board, for all boards actually, the introduction of a national safeguarding board will likely mean clearer expectation, standardised reporting frameworks and a greater scrutiny of local safeguarding performance. And we predict that boards will be required to align their strategic plans and learning processes and data reporting to national priorities, and ensuring that safeguarding practice remains robust and evidence-based. So during the year that's coming, 26-27, the board will be self-assessing itself against the information that we know is going to, that we think will be part of those expectations of a national board. and we'll be seeking local assurances that we've got the right things in place. And I think there may be heightened expectations for the need to strengthen relationships with ICBs as well as commissioning bodies. So we will be looking at that going forward as well. But I think, you know, it really puts us on a footing with children's services who've always been ahead of the game because of the legislation that governs children services. And this is a really welcome addition to adult safeguarding. And to be honest, it should have happened 10 years ago when the Care Act came out. So it's a really positive thing, a lot of work, extra scrutiny, but it's not a bad thing. You know, we can be better assured because of the way that that will work. Okay. So I've in your packs in this PowerPoint, there are contact numbers should you have a concern about an adult. Obviously, you can contact, I would say, Lucy, Sarah, Michael, or myself, and we will definitely signpost you. Otherwise, there is a number there to contact adult care. There is a form online. The address is in your packs. And if you were interested in the policy and procedures that we use, there's also a link to that as well. And just to highlight that we do work in conjunction with Safer York Partnership and the City of York Safeguarding Children's Partnership. So we have an aim to keep strengthening these relationships between the three. Okay, so thank you for giving me the time to tell you about what we're up to, and I'm more than happy to take any questions if you have any.
Thank you very much indeed for that. That was very comprehensive and very interesting. And it's good to see what you're doing. And I know what Sarah said about you joining the board and being your hard work. So thank you for that. So over to the members of the committee. Any questions? Yep. Okay. I think you were first, actually. Yes.
Okay, thank you, Chair. I've actually got 3 initial questions. So if I ask one and then drop to the bottom of the list and come back up again, is that reasonable?
There's not a great deal of hands going up, so I think we can indulge you if Councillor Waller is okay.
Well, shall I try one and see where they go?
Try one and see.
Which hopefully is a relatively quick one. So can I thank everybody for coming along today? And a huge amount of work that's gone in, and we're very grateful for that. Thank you. I'm just asking for reassurance initially, if I may, that the names have been anonymised in the pack, and also that we've had full and informed consent for pictures as well.
Yeah, absolutely. The pictures in the report are stock photos.
Has it stopped working?
No, I think I turned my microphone off.
Oh, okay.
Yes, it's always anonymised unless the person, if someone has died and we do a safeguarding adult review, we usually let the family choose the anonymised name. On occasion, and it's only been once in this past year, they want to use the person's name because they think it's really important, but that is done with the family. Family's blessing. We would never use someone's name unless the family were insisting we use their name, but otherwise always anonymised. And the pictures within the annual report, if it's from agencies, permission is sought. In fact, I might let you answer that, but otherwise they're stock photos.
Yeah, so effectively everything within there is stock photos, and that's been checked through our communications and publishing.
Through what?
Through the communications department of the council and the web design, everything's gone through the governance processes within there before it's been published, and it's the use of stock photos.
Okay, maybe I could learn a little about what stock photos means outside the meeting. I don't know. Thank you.
Okay, so I'm sure go to Councillor Waller.
Thank you, and thank you for the report. My question is about getting information outside of those partnerships. And on page 92, you talk about collaborating with community groups. And certainly in terms of spreading information in the way that, say, corporate parenting is spread. Would that include residents' associations and hubs? There's a wide variety, and parish councils in those parts of the city which have them, and the interface with local area coordinators who do a sterling job, but not every ward has a LAC. But in terms of from the casework that I've received, they've been essentially in dealing with hoarding and a variety of vulnerabilities that residents need support, but also estate managers, whether within City of York Council or housing associations, so that that's a means of spreading your eyes and ears on the ground. And I'd also include, you list specific concerns. I put cuckooing in that as a specific vulnerability that often goes hidden, and it's those groups that I've just mentioned that could help you to find that. Notwithstanding, the police will at some point, but it's getting in early. Thank you.
Okay, thank you for that. In relation to residents' associations, parish hubs, we're not linked directly, but we do have a strategic housing representative on the board. They are linked into housing associations. We do expect our members to spread information to the groups that they work with, but we don't directly link him because the people around the board have areas of responsibility, and they're expected to cascade the information along their own channels. Community coordinators are funded. I'm going to pass you to Michael because I can give you a positive update on that.
Yeah. So there's a really strong working relationship between the safeguarding team and local area coordination. And you're absolutely right, Councillor Warren, in terms of perhaps what some of the hidden harms in the city have been over recent years. I think one of the reasons which the strategy has changed a little this year is to try and recognise that some of those hidden harms exist. And so within the exploitation part of the work stream, that cuckooing, which we often now refer to as home invasion, is certainly picked up as part of that work stream. And you're right, the eyes and ears around that are often not necessarily the statutory organisations. And so the work which we're doing around trying to enable a kind of a wider funnel into safeguarding is part of the work. So that increase around 40% over the past 4 years is not necessarily a bad thing. Some of that is about creating that wider funnel in terms of people being able to refer the safeguarding concerns in, and the widening of the partnership at the strategic level by bringing through Health Watch, CVS, DWP, often agencies which will be able to see that. I think particularly fire and rescue, really helpful in terms of a trusted organisation, which when they may only do one visit to a house, but actually when they see a number of things which are concerning, and involving them in the board, and also they're members of some of the subgroups as well, so they're able to feed into the work we're doing around exploitation, and particularly around self-neglect, which is the subgroup which I'm chairing at the moment. Their knowledge and insights really invaluable. And I think the other thing which I'd mention is probably around things like Safeguarding Week, where we try and make that as public facing as possible to engage as many community organisations. But it's absolutely a point well made that as we move into much more of a neighbourhood community way of working, our safeguarding approach needs to embed itself as much as possible within that.
Councillor Steels Walsh, or did you want to?
Yeah, I did. I wanted to come in on what Councillor Wallace said about being in communities, and I think us as councillors also have a really, really privileged position there, because we often are in communities and we see people in communities that maybe are in touch with other people, or people in our communities mention these people to us who they're worried about. And I think that's kind of really leads into safeguarding being the responsibility of everyone. And we are kind of out there spotting and seeing and having contact with probably some really, really vulnerable people, which is why it's also a really, really important position that we're in acknowledging this and being a part of this. Thank you.
Okay, thank you very much. Councillor Runciman.
Thank you, Chair. Jane, it's mentioned in one of the public health sections, and it's a really important one to know. How do you make sure that your information that comes in from all the organisations, which is impressive when you read it, isn't duplicated? How do you know that this organisation isn't dealing with perhaps somebody that uses a different name, but it's the same person? So they don't tell their story over and over again. It's a very old problem, as I'm sure you know.
Are you talking about when an individual is referred in for support or to several agencies? What we would expect, and I'm sure Sarah or Michael wants to come in on here, is the first agency involved in that individual has the information, and what we're introducing under the multi-agency risk management protocol is getting partners around the table to discuss the individual with their knowledge, so that the information is shared like that, rather than that individual having to tell 8 agencies, so that they can work collaboratively. So instead of suddenly that person finding they've been given 8 separate appointments, it's managed to work out what the priority is for that individual, and that there's a structured approach to the support given to them. Difficult when someone's in and out of hospital,
Yes, it is.
and that's slightly different. So I might pass you to Sarah and Michael, who were doing work with their health colleagues about information sharing. Yeah.
Yeah, I mean, there are occasions when we receive a safeguarding concern or less formal information about somebody, and we pass that through to, you know, that gets passed through to our safeguarding team to find that actually we've already received one or more other referrals from other people, other organisations. That's not necessarily a bad thing. We'd rather get a referral 3 times or 5 times than not at all. So the key message, the first key message there would be, again, if anybody is unsure whether somebody else has reported their worries about a person, please still report that worry or that concern. So we do have a number of systems where we can check the details about the information we've received about the person. One of the fairly recent developments we have is a shared care record, which our front door staff and our safeguarding teams can access, where we can actually see through an information sharing agreement a basic level of information about a person and their information that's held on a number of other organisations' record systems, so we can check quite quickly what we know about a person and make sure that we can triangulate that information. So we do try wherever possible to use unique identifying numbers such as a person's NHS number, so that we can, double check and triangulate that we've got the right person. Again, we don't necessarily, we really would prefer that somebody shares as much information as they've got about somebody when there's a worry. But if somebody was thinking, I'm concerned about a neighbour or a friend, I don't know their full name or date of birth, or I might be missing some key information, it's still always better to share what you know about a person. And generally, I would say our safeguarding team are actually pretty good detectives. They've got lots of contacts across lots of groups and organisations in the city and beyond. I'm surprised sometimes about how quickly they can actually track people down. And again, we can draw on our partners such as the police, the fire service and others if we have a really minimal amount of information about somebody. Often, again, we might receive multiple referrals about the same person, but actually it might be a slightly different piece of the puzzle or different bit of the picture. And that really helps us sometimes to just build up that overall picture in terms of what's happening. And we do track and monitor when we've received concerns, for example, about when somebody was in hospital. We will, we will sometimes entrust that inquiry to another organisation, but we will always track through and monitor the outcomes of those inquiries as well. Don't know if you want to add anything to that, Michael.
Just the second one. Sorry.
I think it's just.
Oh, sorry, Mike.
That's fine. Just to try and pick up on a little bit of what you're saying about how people may tell their story more than once, and you may end up with information being provided to different organisations and how that gets shared. I think one of the things which we've learnt in York is that particularly where we have this issue around self-neglect, we may have different agencies for a short amount of time who've been involved and tried to help, and that information has been held in different parts of the system. And unless we coordinate that, we really aren't going to make the best effort we can in terms of being able to support that person to deal with the issues around self-neglect. So there's been a huge amount of work done over recent months to look at the guidance which we did as part of our last strategic plan, and really just sharpen that up. So we have, as Jane said, come to the next board, the multi-agency risk management process, and also some specific tools around the identification of self-neglect and what to do about it. And key to that is that the message very much that when somebody has that contact, they effectively kind of hold on to that and don't give that up until we're able to wrap around the support of others around that, and very quickly escalate that into the multi-agency risk management process, so we can identify which bits of information are held around the system, so you can have that safety planning around the individual. So it does feel as though we've made significant progress from where we were a couple of years ago around those issues.
Is it a supplementary? Is it supplementary to this?
No, it isn't. It's a different question.
Can I put you on
You,
my
you,
list?
I can be on your list.
We
Yes,
can
thank you.
come round again. Thank you. We've got quite a few. Thank you very much. Councillor Stewart.
Thank you. Yeah, I thought it was just worth maybe coming back on Councillor Maroney's point about stock photos, because if Councillor Maroney's not aware, then I'm sure people on the webcast potentially aren't. They're just entirely generic photos, basically. So you want a photo of a teacher and a pupil.
People who were on the photos looked as if they might not have been able to give full and informed consent. That would be my.
I presume they're actors, aren't they?
If they stop, they tend to be actors,
Yeah.
or people who give us permission for their photo to be, they'll sign the declaration.
Oh, they're just
Microphones.
I assume they're actors and paid, but my question is just going to be on the ability of the person on the street to flag up a safeguarding concern. So, for example, if I went to a sports fixture 15 years ago and I saw abusive language or something inappropriate, there'd be no real outlet apart from me writing probably an old-fashioned letter to the club. Whereas now you'd have an announcement about if you see anything, you would know you go to the steward, you would have a banner up saying text this number and everything like that, so people could flag their concerns in so many ways. But from a safeguarding viewpoint, if you had a thought that a neighbour was a hoarder or something like that, and maybe I should know this, but who would be the obvious person to go to? Because if I had an issue or concern about somebody, what I'd probably do, to be honest, is I would email Councillor Steels-Walshaw or email Sarah, and I would say, this isn't going to be one for you, obviously, but can you just possibly say who it might be for? And then Sarah would ping it down, whichever it may be, or Councillor Steels-Walshaw would say, these are potentially the people. The person on the street, with all due respect, the executive member doesn't know who the executive member is, doesn't know who the director is. So that's my question about how easy is it for the person on the street to know where they should go to. So if you go, for example, hoarding, that could, as you say, one of the real lead-ins to a problem. But which number would people ring? Do they ring the fire brigade and it gets lost, or, you know?
I'll start, and again, I'm going to pass you to Michael or Sarah, because there's been a lot of work done on this within the last 6 to 8 months. But if a member of the public had concerns, it shouldn't matter who they call, whether it's the police, the fire brigade, adult care, because that's the whole point of the board, that when that's first filtered, those individual agencies will screen and make a decision about whether it should be passed on to the council. I think in relation to getting the right response at the front door, from a council viewpoint, and so I'm going to pass you on to Sarah or Michael, because there's been a lot of work being done within the council in relation to knowing what to do when that call first comes in. But I would hope a member of the public within York would probably phone a statutory agency if they had concerns, like I say, be it the police, be it the council. And that's the assurance we seek from those partners about their frontline people know what they're hearing and making sure it goes to the right place.
Yeah, so yeah, so in terms of, as Jane said, wherever something comes into the system, so be the fire and rescue, be it the police, be it mental health trust, if it's a safeguarding issue, that immediately then comes to the adult safeguarding team. So it doesn't really kind of matter where it is, and there's a daily screening meeting which the safeguarding team have with everything which has come to them, which includes partners like the police and mental health colleagues. And as Jane said, in terms of the council's response, so if somebody contacts the council, we're really clear with our frontline teams. We've strengthened the response at the front door so that we've got safeguarding, we've got social workers and senior practitioners overseeing those early conversations which people have. So we make sure that if there's a hint of anything which looks like safeguarding, it gets into the kind of the specialist team as soon as it can. I think the issue about wider public awareness is a really good one, and I think there's definitely more that we can do in terms of making issues around adults at risk and the potential abuse and neglect of them at the same level of public consciousness which we have around, kind of child abuse and those kinds of things. So we do some campaigns around that. Council's been, kind of strong over recent years in terms of putting those messages out. But I think in terms of kind of a city partnership, there's definitely more that we could do around that.
Councillor Steels-Water, I think you wanted to say something.
I just wanted to assure you, Councillor Stewart, that is something that has been on my radar about, where people know where to ring in, and there are plans, I believe, for some comms around this, as well as plans about what is appropriate for what agency as well. I think is something that's really important in there as well, and what agencies can provide. But yeah, safeguarding should all manage to get through to safeguarding, but I do get your point about possibly knowing the right place to contact in the first place.
Yeah, thanks. I think my concern is probably it's not so much once it goes in the system. So if somebody, walks into, if somebody says to a CYC bin man, for example, that home is neglected, I think I'm really concerned about, hopefully that bin man would feed it back up and everything like that. And that's good. I suppose my concern is probably more about the person thinking, I just don't know who I'd pass that query on to. It's hoarding, which might be a fire risk, but if I speak to the fire brigade, will they do? And it's that sort of thing. It's like we've got the Ask for Angela thing that, most bar staff would know, and probably most women on a night out would know, but then for people to think, this is a big enough issue, this is who I need to report it to, this is how I report it, in their busy lives, it's just, people sort of think, oh, it's not important enough, or it'll get lost in the system, or have to fill in a 15-page form. That's my concern. Obviously, you mentioned sort of child abuse. Well, child abuse almost sort of sounds more binary, doesn't it? You're not going to sort of think there's a bit of child abuse there, but I'll tolerate it. You're going to make the effort to report that. Whereas in terms of, I'm sort of thinking in terms of adult abuse, where there should be safeguarding, you might sort of think, oh, are they hoarding, or is it their personal choice? And, are they drinking a bit too much, or is it alcoholism? I think that's potentially the thing about how we can have that you know, that core number to ring, that person to go to, and whether it's something we could do, you know, more about. Now, obviously, we're reintroducing the newspaper, aren't we, that the CYC is putting out, you know, for a year. So is that something that could go in? Those sorts of thoughts, really. Yeah.
Yeah,
Sarah.
it's a really good point, and I think you've just really eloquently stated the complexity of safeguarding work with adults, because of course it sits within a much broader legislative framework where people have rights and choices, and we all have the right to make unwise decisions. And I'm sure there's nobody in this room or listening who has never done something that probably isn't ever so good for them, or might not be the wisest thing to do in terms of how they spend their money or the food that they eat, or whether or not they exercise, and whether they drink alcohol. Those sorts of things that we all know are not necessarily good for us. And I think that's such a key point. When does that tip over into it being a safeguarding concern? So what I would say is for it to be safeguarding, we are talking about adults with care and support needs. So not always, but generally people with care and support needs, or those who are likely to have them in the near future, are often known to other organisations and agencies. So often the health service, GPs, others. People do tend to, come to the attention, if you like, of other organisations. So, we often do receive safeguarding concerns through other routes where people have contacted another organisation first, or another professional or partner has kind of picked up that issue. We do have a duty as a council to provide information and advice to people in our patch, and we do that through a number of means as well. So we do have web pages for people who can use the internet and access that information. So people can search for information on our Safeguarding Adult Board pages and use those forms, or on our council website, and links into things like Live Well York. And we do, I think, we do offer quite a significant amount of training across the council and to councillors, as do other organisations. There'll always be more that we can do, I think, to raise awareness about safeguarding. And I think, again, the key message would be, if you're not sure, it's almost always going to be better if actually you say something and you report a worry, and you can talk, you can talk to our safeguarding leads, you can talk to one of our really good safeguarding social workers, to talk it through, to decide whether it's something that should be a referral or not. So it doesn't necessarily have to be a very formal matter in the first place. The other thing that I think often will put people off is somebody might have a pretty good relationship with an adult, and who they might be worried that that person might see them as making a judgment about perhaps their choices and the things that that they're doing that might not be ever so good for them. I think that sort of responsibility, you can talk to somebody in confidence if that's your preference, but it's almost always better, I think, to talk about your worries with somebody than not. But I think that the work that we do in safeguarding adults is generally much more complex than it is with children, because adults have choices, and we sit within a completely different framework. So in my experience, there's rarely ever a right, one single right answer or one clear path through to supporting people. And that, I think, is also why making safeguarding personal is so important, that we work with people, to try and agree with them what the kind of course of action is going to be as well. Thank you.
Can I just thank you for that really excellent question? A supplementary, yes, certainly.
Thank you. Just to follow up on that, what mechanism, you want people to report things in, you cannot give them a running commentary about what you're doing. So what the question would be is, how do you reassure people that nothing's just put on the, oh, it's too difficult pile, that there is someone who checks all of the information that comes in, and that's followed up, and that's really as much as you can say to the person who's rung in, to say, this is the system that we use to make sure that we want to encourage people to ring in and feel confident that action has been taken, but they won't get that feedback.
Yeah, so that's, we have been looking at that process in quite some detail recently. So, yeah, certainly if somebody raises a safeguarding concern, then the person who raises the concern, we can get back to them. It's the level of detail which we're able to get back to them about. So, where we're working with an individual, we'll have the conversation with them about what outcomes they want to achieve and how much of that they might want to share back with other people. So that'll be done on an individual basis. But you're right, the bare minimum which somebody who refers into us can expect is that we get back to them and say, yes, we've got your concern, we've looked into it, and we've achieved an outcome. Yeah.
Thank you very much indeed. It's really, really important. Yeah. Right, Councillor Maroney.
Thank you, Chair. This is more directed at the strategy 25 to 28. So I thought you were before me, but sorry. And in light of CQC visit and report June and December 25, where safeguarding itself got a score of 1, was coded red. And one of the quotes was, systems and practice did not reflect effective management of safeguarding. I find it surprising that there's no reference to CQC in what's been presented to this committee, with an addendum, a rewrite, a commentary to go with the strategy. I'm sure an awful lot has gone on behind the scenes. I just wonder whether you could fill some of that in, please. Thank you.
I'll start with that. This is a report for 24, 25. CQC, yeah, it's 25, 28, which was prepared in towards the latter end of 24, wasn't it? From the CQC inspection took place last year. In relation to those processes, that was a council issue. What we as a board have done is seek assurance from the council about what they are doing in relation to the CQC report. So that's already come to the board in relation to the action plan about improvement. And that's why I'm cited on some of the work in relation to the front door and the question about feeding back to people who've made concerns that was raised by CQC. So, the board has already had assurance about those process changes. And I think one of the process changes CQC picked up was that we have a board strategy, a board policy and procedure and process, but there wasn't an adult care one that dovetails it. So that automatically that would have been, from a CQC perspective, police have their safeguarding procedure, health have their procedure, where is the adult care procedure? But had been quite common in the past for councils to rely on the board procedure instead of having a dedicated adult care one. But from a CQC viewpoint, adult care didn't have their own procedure, even though the one that the board had written is actually based on your procedure. So that is something we're really well cited on as a board, that in relation to the action plan, that is coming for updates to the safeguarding board. So I don't know whether there's any more Sarah wants to answer on that.
Well, I guess just to reflect that we did have an extraordinary meeting of the Safeguarding Adults Board to focus on the CQC report for the council. There was also intention for the board to have a similar focus on CQC inspection reports for the NHS. And so amongst the range of partners, they will have their own inspection or assurance regimes and reports that come through. So as Jane says, as an individual organisation, we have that responsibility to report in, and the board has the responsibility to seek that assurance from each individual organisation, which we have done really effectively. There is, and there will continue to be, further inspections and assessments of other partners that again the board will receive and will monitor some aspects of in terms of improvements. Yeah.
If I may,
Yes.
sounds a bit theoretical. I just wonder whether you could give us a couple of examples of how things have actively changed as part of this heavy work going on behind the scenes.
Sure.
Thank you.
So I think James referenced the work at the front door. So we did have some concerns last year that some of the decision making in terms of when people had called with or emailed with concerns about an adult had been closed too soon, particularly where there was some concern about self-neglect, but the adult had declined support at that point in time. So that was something that we'd picked up through our own audit processes, but also through the thematic safeguarding adult review. So as a result of that, we took some immediate action to actually say that rather than our front door staff taking decisions at that point as to whether something should progress into triaging for safeguarding or not, that we would prevent them from being able to actually close that inquiry at that point, and they had to pass all of those referrals through to the specialist safeguarding adult team, so that those qualified social workers could review all of those, all of that information, and make a decision, which was then also reviewed and approved or not by a senior practitioner or a manager in the team. So we took that immediate action to give us some time to provide further training and support to some of those colleagues who were responsible for taking those initial calls. And then, as Michael referenced, what we've actually done is we've placed senior practitioners, qualified social workers, occupational therapists and other colleagues who now actually work alongside those call handlers who take those calls. So they've been receiving sort of on the job, if you like, guidance and support. So a social worker may talk through a call that's come in with one of the call handlers there, and then to discuss the concern, to discuss what sort of questions the person might ask. We've also employed practice development leads who've carried out some audits of decision making. So really pleased to say that those sort of independently employed practice development leads have carried out audits on decision making as to whether something shouldn't progress to safeguarding, because that's a really important decision, as well as when things have progressed to safeguarding. And that's demonstrated a good level of assurance for the decision making within the team. What that's allowed us to do then is to actually broaden the training and development and focus in on further areas of good practice that we would want to develop. So one of those areas of good practice that we weren't as assured about was the point about whether we were giving feedback to other professionals when they have referred people in for safeguarding. As Councillor Waller noted, we can't necessarily always tell people what the outcome has been because we would need direct permission. But what we can do is, in every case, we can provide assurance to the referrer that we have received the referral, that we have taken action, and that we won't just close that inquiry without taking that action with people. We've also, over the last 12 months or so, we've further developed our processes for assessing the length of time it takes for us to deal with all referrals into adult social care, including safeguarding. And we have a really detailed report that gives us a snapshot that we can also then look further into, that will tell us what number of inquiries or referrals we've had and at what stage they are in the overall process. We can monitor those on a week-by-week basis. We can look into who is the person with the longest wait, if you like, or within the process for the longest period. We can compare that data by team, by individual social worker, so we can look at whether there are any anomalies there or anything that's sort of standing out in terms of something that we need to be looking into. And my two assistant directors, Michael and Anne, who's not here tonight, have also undertaken case file audits of safeguarding inquiries themselves. We've further received some support from the Department of Health and Social Care, who commissioned an external auditor who's undertaken a significant number of case file audits, again reporting back to Partners in Care and Health and the Department of Health and Social Care on the quality of practice and the decision making around those. So that's a lot, but that is just a small proportion of the work that we've undertaken in the last year or so. Thank you.
Could I just briefly comment on that? I mean, thank you, Sarah, for that typically very helpful and detailed answer. I suppose my angle was coming from, I would assume the board would have an oversight of that and would be able to present a synopsis. I'm not I don't want to labour this any further, but my point still is I'm surprised that there wasn't anything in the pack we got.
I think Sarah pointed it out, the board is bigger than adult care, it's bigger than the council. There are 3 statutory partners and we seek assurance from all those partners when they have inspections. So those inspections, we do expect the results of that to come to the board. So like Sarah said, you know, when our various health partners are having CQC inspections, we want those we want the results of that reported to us so that we are cited on where improvements are needed. But more importantly, what the board can do to support partners, depending on what those concerns have been raised. So we're not just, you know, it's the council that needs to focus on the CQC, which is happening, and Sarah's given a very thorough answer. The board held an extraordinary meeting in January on the CQC report for adult care. We are also doing that for one of the foundation trusts, so that we can get their assurance about what's happening in relation to their CQC outcome as well. So I don't know if that helps, but the board seeks assurance in relation to these inspections, of which adult care is only one part of the board's assurance process. We're not just focusing on the work of adult care, it's all partners that we're focusing on.
Certain supplementary.
Just to follow up on that, when you mention audit of cases, is that 100% or a sample audit?
Yeah, it's only ever going to be a sample because of the sheer volume of referrals and casework that we have. So just in terms of safeguarding alone, we've been receiving over 100 concerns per week, some weeks a little bit higher. So what I will say though is, in terms of the performance framework that we've been implementing, every single decision and every single piece of casework does need to be reviewed and signed off by a senior practitioner or a manager, and in some cases both. So we may not have a third-party audit of every single piece of casework, but actually we've been introducing a really significant number of audits. And again, to give us that assurance in terms of objectivity, we've employed, or we've had support from external, very experienced professionals who've also carried out some of those audits. So we're not just, if you like, marking our own homework. So we have an internal process of audit, which most councils should have in place, which is good practice. But we've also invited in those partners to carry out those further audits for us.
Okay. Councillor Myers.
Thank you, Chair. And thank you for the report and presentation. I'll do a real quick bit of comment as by way of supplementing. Councillor Waller's question was really good, and on hoarding, I did just want to add, you have answered it, to be fair, but I did want to add that there are charities, of course, and community interest companies that do this work, amazing work in communities, and you know, I'm not assured that they potentially would know, as councillor steward, very, very well put, where to go with an area of concern. So I'm sure you're aware of that, and you answered that, so I don't need you to do it again with your neighbourhood model way of working, but it'd be remiss of me not to mention it, because it's on my mind, and the local area coordinators are well worth their weight in gold, there's no doubt about it. My question is about the strategy and how you're measuring its performance, and it mentions you're going to develop, or you could have already done the developing of a business plan to measure it by, but I don't know what that looks like. So my question to you is how you're going to measure that, and are your objectives my areas of concern reading the report may not necessarily get covered by your objectives, and I just wonder, because they don't seem to be very clear, an example I'd give is the instances of abuse taking place in care homes, but then are there any objectives that say you're going to work really closely with care homes to either identify more of that or work in advance of those cases becoming really big safeguarding risks? And I'm sure, you know, I'm not doubting that you're going to be doing that work, but around this committee, I'm not sure that that's actually happening.
Okay, there are two parts to that, I think. In relation to the strategy, there is an action plan that sits behind each of those priorities, and that's get refreshed on an annual basis. And they are SMART objectives. So as we're setting the actions, what we're also setting is how we will know we've made a difference, so that we can actually report back on those measurements. So yes, that's not been presented to you tonight. The annual report is on the web, the action plan is on the board website. The board is well cited. We get progress reports every time we have a board meeting. It's RAG rated, so if things are getting sticky, that's where we're asking partners, what can we do? You know, things that if there are certain aspects of it that we're struggling with, we may have to go back out to partners to say, what can you do to help progress this particular action so we can achieve it and know that we're making a difference? So there is a measure against each. That's why we have a dashboard, so that we can, some of it's database, so that we can see either increase or decrease depending on what the issues are. Some of it's qualitative. Some of it is agencies reporting back about the difference that they can see in their practice. So there's lots of different measures depending what the action is. In relation to the care home example that you gave, we do track the data. There is a robust system for adult care. I mean, I know that's just one element, you're using an example, but there were probably each individual element will have a similar pathway, if you like. So in relation to care homes, the commissioning service within adult care get that data. They know where those concerns are coming from a provider viewpoint. They are looking at things from an organisational viewpoint, so that can be tracked. There is a process, a multi-agency concerns process, where agencies can come together if there's a concern about a particular provider. And the earlier you know there's a concern, the quicker you can get involved from a multi-agency viewpoint to work out what that problem is to support that provider before it becomes, you know, a hideous safeguarding organisational concern. So that's why we are interested in the data, to make sure from a prevention viewpoint, we can respond quicker rather than waiting for, you know, a care home to be in crisis because of a staffing issue or sheer disregard to what they should be doing.
So I think one of the improvements which we've made this year is around the dashboard work. And I think one of the differences which we've made is being able to, through having the board manager in place, having the structure expanded a bit, it's enabled that quality group to do some more work around that. So the dashboard which we use it's a collection of information which comes from all the different agencies which they then collect, which we've structured in a way which responds to the objectives in the strategy. And we can then track what activity is happening against how we would expect the strategy to have that impact. And that comes to the quality group. And then there's a group of professionals who are then able to look at that data intelligence and make a judgment about what that's telling us. And that then goes to board. I mean, it's not a perfect process at the moment. It's still a bit of a work in progress, but you know, we've made significant steps, and that's one of the main mechanisms about how we understand how we're making a difference.
Okay, thank you for that. Councillor Runciman.
Thank you, Chair. This is a question about a comment on page 99. I'm very interested to know how you are going to find ways to capture lived experience. Now, I actually think you're doing that vicariously with the little case studies that you've included, but I can see that that's a very sensitive area, and I wondered how that's progressing.
It's an area we are constantly working on, because there are various ways of doing it. But one of the things that we know we can track is via partners themselves who can provide those case studies. That helps, but it's also getting feedback from individuals as well. So from a safeguarding perspective, at the end of the process, the person can be asked that they are happy with their outcome. So that's getting that lived experience back. We are engaged with advocacy. They are part of the board now, so they can provide stories from those who aren't able to represent themselves. Health Watch can be very helpful in either being directed or where we're concerned about a particular provider will go in. And they, of course, as you know from their reports, are very good at asking the people who are receiving the services their viewpoint. So there's various ways of doing it. Sometimes we have invited people to come and present their own story if they want to. Never force anyone, but there are people who really find it quite helpful to be able to discuss their own circumstance, and that is really powerful, because if you're hearing it firsthand, but it doesn't have to be face to face, it can be done via a written statement or via their key worker or the person that's supporting them. And that's also done via training as well. So, you know, whenever you're doing training, you're trying to get the voice of the adult as part of that training and feeding that back out to the people who you are supporting, so that they can see what difference changing their practice would have an impact, because this person is saying what would work and what doesn't work. So there's all sorts of way. I don't know if that helps, Councillor Runciman. Yeah.
Thanks. Okay, Councillor Cuthbertson.
Thank you, Chair. I represent one of what is seen to be one of the more affluent wards within the city, but like most of the wards in York, it has its share of deprivation or illness of one kind or another that leads people in down a certain route. I've experienced 3 such occasions where I think each one of them was beyond my ability to, apart from dealing with an initial introduction and trying to understand what the problem might be, but to take it further. I was fortunate in being able to rely on a very experienced LAC, local area coordinator, who actually dealt with safeguarding and 1 or 2 other implications. The first one was the really difficult case. This was a man who lived on his own in a semi-detached house. It looked okay, the neighbourhood, but when you looked at the house, it had all the signs of decay, despair, deprivation, everything else. He was a hoarder, and he had the unwillingness to talk about anything other than what he wanted to talk about in that conversation, and I was totally unable to answer that. Fortunately, the local area coordinator came to my rescue. But I just wanted to say to you, the training that you've just mentioned, Sarah, I think will be really useful for councillors, and whether that's done through the Safeguarding Board or through the Adult Social Care Team, I think it will be a very good thing to have on a wider basis. So I'm only just going to make that one positive contribution. Thank you.
Thank you. So you've just really helpfully just given me a little opener into a request really for all councillors, if possible, to join us in a briefing session that we're just in the process of planning and setting up. I think it's going to be at the end of this month. So it'll be a session that's open to all elected members. We will be sharing some of the lessons learned from the thematic Safeguarding Adult Review, which has a focus on self-neglect, including hoarding. Again, we do think that local councillors will tend to be, in many cases, people that, you know, local residents may come to, or you may be people that will spot some signs of concern amongst your constituents. So I would really welcome as many councillors as possible joining that session. where we'll focus on that safeguarding adult review. We will also be really happy. We'll have Jane and Michael will join us, as will Catherine, our board manager, and Tanya, who's our safeguarding senior manager. So we'll be really happy to spend some time, you know, talking through individual circumstances and cases, if that's helpful at that session. We'll also be able to talk to you all about any further training or development that you think might be helpful, you know, for yourselves and some of the people that you're working with. So would really appreciate if you could perhaps drum up the interest amongst your colleagues and get as many people as possible along to that session, please. Thank you.
We certainly will do our best with that, I promise. Yes.
Could you say when that will be? The reason I ask is that it would be helpful before ward committees allocate resources, because previously Westfield allocated a pot of money to the LAC to allocate as they needed to for the organisations, the CICs within the city who do that work, and therefore it would be helpful with the timing.
So the date, I believe Democratic Services are just confirming, but the date that we've got scheduled is the 28th of April. So hopefully that will get confirmed, and we'll get a room confirmed for that within the next day or two.
And I think that relates to the email that you got actually earlier. That's yeah. Councillor Vassy, please.
Thank you, Chair. Like everyone else, I welcome the report. What has struck me most about this, I'm really pleased to see that there's been a focus on producing guidance. I'm still concerned about how that operates. So my question relates to that. First of all, I should say, I've not heard anything yet today about what happens for wards that don't have a local area coordinator. I'm glad that they're working well, but there are at least two, I suspect there are 3 or 4 wards in the city that simply don't have that resource. And that's a major concern for wards like mine. There was a lot of discussion about the difference between protecting children and protecting adults, and the difference in context of dealing with adults. One thing that struck me from the guidance was that there were lots of assumptions that everyone would understand the meaning of words like capacity. And I'm certainly not sure that's the case. In the past couple of years, I was with my father in his last months, from when he stayed at home to when he ended up in a care home. Through that whole period, his carers started off there was just someone coming in to give him a meal once a day. There was me. Then there were community nurses coming. The GP decided my father had capacity. I'm not sure that was effectively communicated to other people. And when we talk about the multi-agency thing, that immediately makes me think, to what degree is that information about someone having capacity communicated? And immediately, what right does the individual concerned and the family have to say, well, I don't want that information shared? So that whole complex web of how we relate to capacity. And the other thing that struck me in the leaflet about self-neglect, again, relating to my dad, was there's a list that's very helpful about what causes self-neglect. But the thing that actually caused self-neglect for my dad isn't on that list. It turned out he hadn't had a bath for 3 or 4 months, or a shower. And yes, he was physically frail. And yes, he was in the early stages of vascular dementia, but he was deemed to have capacity. What actually prevented him having a bath was shame and embarrassment. It's not on this list. There are very basic human things that leave adults with capacity unable to solicit help. So I suppose my question there really is, what are we doing? What is the board doing to talk to people at the front line, the carers, the caregivers. I know, Sarah, that you came up through this, if I've understood correctly, through that route. The voices of those people directly on the front line in the care homes, providing the meals, I didn't really form a view that the guidance had spoken to them hugely. Am I wrong in that?
It's always a knotty issue. I think you're right. People do struggle understanding what capacity means. And we actually had a meeting this morning and I was saying we need to make sure that we cover about mental capacity when we do provide training. And capacity is decision specific. So when the doctor said your father had capacity, was that in relation to him taking his medication? Was it to do with his finances? Was it his ability to bath on his own? Those are all separate decisions and it's very nuanced. And it's a constant theme for providers of the need to train their staff to understand mental capacity and best interest decision making. And of course, workforce has changed. You can't just do it once. It's got to be a rolling programme of training and it is nuanced and it can be quite difficult. But it's the social worker and occupational therapist bread and butter. They understand it, cut them in half. They will have it written in. They understand it. The key is getting it through to other providers, more frontline people who may not have quite the same level of training given to them, so that they understand why someone might not be wanting a bath, what that choice might be. And actually, when we do training on self-neglect, it absolutely covers embarrassment, dignity as a reason for refusal. So while it might not be on that list, the training would certainly cover that aspect of it.
Yeah, so it's just to say that the work around self-neglect's been ongoing. So there's an updated guidance which is going out and will go through the board in the next very short while, which is more comprehensive than that. I will go back and check it to make sure that those issues around shame and things come out strongly within that on the basis of the discussion which we've had. And as Jane said, the issues of mental capacity are really quite nuanced. I think for me, the most important parts of that often are to help people to make decisions, and the judgment around mental capacity should never be a kind of a one-off judgment. And everybody who's supporting people should really try to make sure that they give the most autonomy that you can to somebody to make those decisions. We've recently revamped our mental capacity training to try and make sure we're as focused around those issues as possible. But it's an ongoing issue which I'm glad you've raised.
Thank you. Can I just follow up, Chair?
Yes, sure.
Again, relating to the guidance and the points we've just discussed, I also read with great interest the Professional Curiosity is Everyone's Business leaflet. And what struck me was that it was full of really useful information, but presented in a way that I could not convince myself that the people who I witnessed caring for my father would have been able to access easily. And by that I mean there are pages where there are 16 bullet points on things that you might do to engage with a person. The way it's presented is pretty impenetrable. It's off-putting because there's so much crammed on a page. And it made me think of the people who came and helped my father with his food at lunchtime, or the people in the care home who looked after him. People who came from all different countries around the world, who brought their compassion. Only one person I ever met wasn't full of compassion and caring. But I struggled to believe that they would look at a complex page with 16 different things all jiggled all over it and find it easy to engage with that information and to get the really good, I mean, it was good information. It was a presentation issue. So again, I was left with the same question: to what degree do you sit down with the people who are going to be using the document and check with them that it's readable, that it's engaging, that they feel able to get benefit from it?
That's a really important point. So I did start out as a care assistant just a few short years ago. One of the things that's changed it's 27 years actually. One of the things that's changed in that amount of time is, first of all, there's a statutory inspection regime for care providers, and there's a significant focus on statutory training for care staff. So care staff who have to complete a care certificate, and when the Care Quality Commission inspect care providers, they will be looking at training records. They'll be looking at what training, advice, support and briefings are provided to staff in the city. Now, that is not the responsibility of the council per se directly, but it is also something that we will monitor when our contract monitoring teams carry out their quality assurance visits. We'll also always provide help, support, advice and guidance to any provider, regulated or not, in the city who are seeking that. And we are working with, for example, our Learning Disability Partnership Board to look at how we can produce easy read information and information that's in other accessible formats, because of course there'll be a range of communication needs, both for people who use care and support services as well as those who are delivering them. So what's most important, so we could produce 10 different versions, I think, of a document, and it still wouldn't be accessible for everybody. It is for providers and employers to make sure that they're making sure their staff can access that information. And again, we are here, the board and the partnership and all partners are here to provide advice, to provide advice and support where we can to help providers to do that. Yeah.
Could I just add something? From my experience as the daughter of somebody who was receiving care within the city, and I found them to be highly trained healthcare assistants. And I've also just been in receipt of care from the healthcare assistants myself, and they were incredible and incredibly well trained and knowledgeable and helped me no end. So the only reason I'm sitting here is probably from their care today. So I can vouch for that side. I'm sad to say that I had to vouch for it, but that's certainly my understanding of it. I have one last person on my list, because you did ask for 3 questions, Councillor Moroney, and then I think we have to call these questions to an end. But I think it's been a really valuable session, and I think we've brought up so many things. There's so many facets to safeguarding, and I think we've covered such a lot of ground today. So have you got? Are you sure? Oh, we were all waiting for it. Oh, well, Councillor Stevens.
Well, given the gap in seedings, yeah. I do actually, unfortunately, have a very, very real example with my father, which I won't touch upon. But let's just say it's going to an inquest months from now. I won't comment largely because of the care home, and that's not going to go anywhere other than a legal sort of thing, and some of their mistakes. I was amazed by things you would never know. I'll give one example, and I know it shouldn't be about personal case, and I should say as well, this is not York, this is North Yorkshire, and and North Yorkshire safeguarding I was very impressed with. But one example, my father, older gentleman, had bed sore, and the care home were told by the doctor he needs this particular type of mattress. The care home got that particular type of mattress in, and then they weren't sure who it related to, and so that mattress was put in a store cupboard and never went to him at all. And it's very, very difficult to comprehend that level of incompetence. If you think about an office and you say, we've got some post-it notes, who's ordered them, and you're not sure, so it just gets left. But a mattress goes into storage, I say ultimately it was the most extreme of outcomes, and that's a whole different thing. I've got some very strong views about lots of aspects of it. Starkly, it said on my father's death certificate, neglect, is one of the causes of death. I don't think that was by any means the only thing, but but that's pretty stark. And, you know, he wasn't financially deprived or anything like that. So, but that's a whole different thing. I just wanted to come on Councillor Vassey's point about the sort of capacity, you know, because it is interesting, the whole different levels of capacity. And I work in financial services, and it's very important there in terms of we have a vulnerable client rating, which is basically anyone over 80 and then anybody else who could be vulnerable for various different reasons. I would take issue with some of our regulators' views on what vulnerable is, and I hope they're not watching, my regulator, because they are all powerful. But for example, they would say if somebody divorces, they become vulnerable. They should be treated as vulnerable. I would say divorce could be the best thing ever for certain people. You know, various things like that. You know, it's weird how we make these judgments. But the point I was going to make is obviously as people get older, then obviously things like dementia can become more common. And the thing we're the keenest to do in the industry is to involve the family members. You know, really, really keen. And obviously we have to do that sort of in a quite subtle way sometimes, just, you know, and the way we do it is sort of say, well, lots of people in your situation like to have their family get more involved. And we talk about things like, you know, if, for example, you're run over by a bus, and I know, you know, grossly insensitive if anybody is run over by a bus, but, you know, it's one of those things that's not likely to be the way they're going to die. And so you have that sort of experience. And then if we can get to speak to the children and involve them in that decision making, I think that's a really positive thing and great for everyone concerned. So my question is the extent to which, you know, we have safeguarding concerns, and this is particularly about an older person, we bring in family members and try and bring in family members. And as a balance of, it's that, and in my dad's case, for example, you know, so he had a lessening of capacity, but I was very, very clear with, you know, people sort of said, well, that's because he's a bit lost. I said, no, he's always been an awkward so-and-so. That's a different thing. Obviously it wasn't passed on to his son, clearly, as you can see, but, you know, he's always sort of had that, you know, side of things. And then there's a separate, like the whole thing about the ability to make the wrong decision, but still have, you know, capacity. So the question is, are we doing everything we can to bring in family members? Because I just think, particularly on financial capacity, you know, that's really key. Get them involved, because there was, you know, stage in my dad's looking at his needs before he went briefly into the care home, where lead social services were very, very good, you know, really good. And the way they sort of involved us and part of the process and, you know, everything like that. So sorry for the rambling, Chair, but
It's okay. It's a very emotive
Right.
subject.
Yeah, I think the short answer to that is yes. In terms of family members, it's a core part of the work which not just the safeguarding social workers, but social workers do, is to try and use that network around somebody to support them and to try and enhance that network, and to treat family members as, you know, often the most important people in somebody's life. It's only in the kind of exceptional circumstances where somebody says, I really don't want to have my family involved, or serious concerns about abuse, when you would not do that. But the kind of the rule is you start from the assumption that actually involving family and community and things is the best way forward.
With the proviso that a lot of abuse can take place in the home, I suppose, as well. There's that side to it as too, which like the home rather than a nursing home, which is, it's a minefield really. And this capacity and fluctuating capacity, I had also experience of that. You just, it's enough to make you lose your own capacity, to be honest. So I don't know if you want any particular recommendations tonight. I think, you know, we've read through it. One thing I did notice on page 95, how to assess what impact we are making. I wondered about exit interviews for people employed within the different areas, whether that was something that you did. That was just something I picked up and thought of. Because, you know, when people are actually in a position, and I noticed that it was something that came up throughout the report, that sometimes people were reporting things and they'd had to have strategies in to protect the people. And that was something that you dealt with. But it makes an employee quite vulnerable when they're raising whistleblowing, really, I suppose. But So exit interviews, at least, you know, they're going then, and you might get some really honest opinions. Sorry, Councillor Waller wants to say something.
Just in terms of recommendations from today, I think you mentioned safeguarding week coming. Is it the same week as the children's safeguarding? Yeah. Right. So it's that week in June. I think the recommendation would be the raising awareness among community groups. That would be something that I would feel strongly that what you've just shared, that would be a tangible example of the engagement coming out of your policy, and we would be able to see it as councillors as well as other organisations within the community.
Something I noticed as well was, what is a safeguarding issue? Some people might not actually realise what they're doing is a safeguarding issue towards the person in question. Councillor
I think another recommendation would be ongoing safeguarding training for councillors, and making safeguarding training, say by video, available more widely to the public, so that they could pick that up if they felt there was an issue which might address what you were just talking about.
Yeah.
Yeah, just on that, as a school governor, I have to do children's safeguarding online training every year. It would be helpful on that point if there's an equivalent for adults, then that could be shared.
Yeah.
There is an equivalent for counsellors through adult social care, yeah.
Right, that's really good. Councillor Stewart.
Yeah, I mean, just first that point, obviously, if we're talking about training for councillors, there's 47 of us. Who's available, it whittles it down. But yeah, the ability, because I don't know how many people can be on a Zoom call or Teams call. I'm assuming it's pretty unlimited. So throw it open to parish councils, resident associations, school governors, you know, all those organisations, chairs of associations. If you just throw it open and get the message out, and then just sort of back to the point I was making earlier about how easy it is for people to know who the safeguarding people is. Obviously, we've heard, you know, we can report it in, all those different things, but I'm still not clear that we've got that easy thing to say to people, you know, well, if you've got, and we've got, for example, we've got the contact details of the board, haven't we, in here? Unless I've missed them, we don't really have the contact details for if you've got a safeguarding concern. And so for me, it's whether we should be like, anything safeguarding is 511 511, or safeguarding York at safeguardingyork.gov.uk, just to give people some really, really easy things. Have we got them?
They're in there, yeah.
Oh, brilliant. Okay, fine.
Yeah.
Brilliant. Well, I mean, sorry. Okay, brilliant. Well, that's great. That's good. That's great.
Councillor Massey.
555.
Yes,
Right, sorry.
conversation that's been around the table for 2 hours. I would certainly like to see a renewal of the proposal that the council looks to ensure that all wards have access to a local or area coordinator.
Yes, sorry, I did note that down.
It's gone on for a very long time, and we've heard a lot about the advantages of having them.
Yeah. Yeah. I can see in a rural area, it might be more difficult, because in urban areas, they can go to certain places, but I have actually written down lack of a lack, because that I know how important it is in my ward. Yeah. So another thing to take away. So could I thank you all very much for coming along this evening? Oh, one last point.
So sorry, Chair. I mean,
See it being used, Councillor Stephen.
no, it's my fault. I didn't read it properly. You're absolutely right. Jane does say about the number here, but sort of further, I mean, the email address is for, you know, the board, isn't it? So I'm just wondering, in this world, you know, a WhatsApp number, because we've got a text for hard of hearing, and then an email. Is that?
WhatsApp.
Is that some? Please tell me. You're going to tell me it is somewhere else on the next page or something, but.
There is an a safeguarding adults online referral form that is for the public, that says safeguardingadultyork.org.uk. It will also be on the council website. There is a page, if someone typed in safeguarding in the council search button, it will take you to, are you concerned about someone? And there will be an online form on that. We've also given you the board's website, which also has a concern form and a number telling you who to contact. So it doesn't really matter which route you go in, whether you look at the board or you look at the council, you should hopefully get the information you need.
Or you can ring if you don't have a digital, if it's for the digitally excluded.
555 111.
Yeah, yeah. sorry, I will call it a day now with all these questions. Thank you very much, all of you, for coming along tonight. It's been a really excellent session, and I think we've raised so many issues. It's 2 hours into it. Please do feel free to go. Yeah, sorry. We've been here for 2 hours. Would you like a break before we go on to look at the work plan, or shall I just move on to the work plan? Keep going. Okay. Is everybody okay with that? Health wise, they're all right. So, I might actually hand over to you, James.
Yeah, thanks, Jeff.
Sorry, I've dropped you in it. There we are. Do you want this one?
Sorry, thanks, Chair. Yes. Yeah, just to give you a sort of brief update, I think because this is the last of the committee's meetings of this municipal year, I think probably if everyone's happy with this, we'd look to get an informal work planning session in perhaps late May, early June. Our next formal meeting currently is in July. Perhaps to get something in.
So I hold up my talk to text switch on, so I have a clue what you're talking about. Can you sort of summarise it again?
Yeah, apologies, Councillor. Yeah, so we'll look to, if members are happy with this, we'll look to get an informal work planning session set up for you ahead of the new municipal year. Perhaps sort of towards the end of May, maybe into early June. Our next formal meeting is July at present. Just to mention as well that we've got the Scrutiny member briefing session tomorrow evening. This is reference, I think it's page 128 in your agenda pack. And there's an item that's come from this committee around school attendance and the attainment gap. So that'll be tomorrow evening. And if members aren't able to attend, we're not currently recording those sessions, but we can provide slides afterwards. So that'll be tomorrow evening. And I guess the other thing I wanted to mention is maybe sort of perhaps handing it back to yourself, Chair, or to the Vice Chair, but I know you'd had a meeting around scoping the task and finish group around repairs.
Yes, indeed. And I've spoken to Councillor Waller about the two members of the Labour group, Councillor Rose and Councillor Carrott. Over to you, Councillor Waller, on this.
Thank you. At the meeting, there was a detail of the time frame which would need to take account of the inspection from the housing department. Therefore, the objective would be to get that going for July so that the task and finish group can deal with its own internal things. To set up meetings in the September, and then by October, officers will have been through the 3-month guidance from the housing inspectorate, and therefore be able to engage with the process. So it's slightly different to the draft that has been circulated, but that takes that into account.
That's great, thank you. So at the next meeting in July, we have the SEND strategy update, and I think by then the food insecurity task and finish group will be ready to report. That's been delayed by bereavement, unfortunately. So any other points you want to know?
Thanks both. Yeah, I think that was it. I guess the only question was if you just sort of if we had any other kind of updates to members for the task and finish group.
Not on the task and finish group. Are we going to deal with the housing pre-scrutiny issue? The only reason I flag it up is that you'd circulated an email to myself and the chair in advance of the meeting, referring to a reserve date of the 24th of June, which I don't have in my diary. And if members of it, we would need to make sure that if we were having items relating to it, papers going to the executive, and I will flag it. I did feel that the housing delivery programme report, which went to executive yesterday, should really have come to scrutiny. It was a prime example of a major strategy that should have come through scrutiny before going to executive. Therefore,
I think you're at an advantage in that I haven't read that
Right.
email.
so
So
I would just
could
flag up,
discuss
if there's
them.
an assumption there's the 24th of June meeting reserved, then we need to know
Okay.
that it's reserved so that it's in our diaries.
I think we'll have to discuss this
Yes.
between us and get back to everybody
Right.
on the committee about that, if that's okay. But thank you for raising that.
Right.
So, thank you all for a very successful meeting. I don't think there's any urgent business that I know of, so I'm closing the meeting now, and thank you all for your participation.